That's right, Kelly. The virus has now reached more than 40 countries with total case numbers worldwide topping 82,500 and more than 2,800 dead. The World Health Organization telling every country to be prepared, citing the virus's, quote, pandemic potential. That includes being able to detect cases early, to isolate them, trace their contacts, and provide quality clinical care. The Director General saying people need to have the right information, including what the disease looks like. In 90% of cases, it's a fever, and in 70%, a dry cough, typically not a runny nose, he said. Those efforts to isolate, care, and trace contacts are now being done in California around the first patient who may have caught the virus through community transmission in the United States. The patient's being treated at UC Davis Medical Center in Sacramento after being transferred from another hospital. UC Davis says out of an abundance of caution, a small number of its employees have been asked to stay home and monitor their temperature. California Governor Gavin Newsom just now in a press conference saying the state's public health officials have been in touch with the CDC about expanding testing protocols after that patient had to wait several days for testing due to narrow federal testing criteria. He said the CDC assured them they'd be advanced with urgency. He said California has just a few hundred testing kits right now, which he called, quote, simply inadequate. Guys, we also saw a number that California is monitoring 8,400 people. Those are people who came back through commercial flights who would just be monitored under the regular system of monitoring people who traveled back from China.
And those are people who have been monitored but not tested per se.
Well, California only has a few hundred testing kits, so it couldn't even test them anyway.